Joining me now live to discuss is the Vice President of the Australian Medical Association, Dr. Chris Moy. Doctor, thank you so much for joining us this morning. Let's start by talking about rapid antigen tests. 6.6 million welfare recipients will have access up to 10 free tests under yesterday's National Cabinet announcement. Does this announcement go far enough?
Look, it goes a some way. There's still a problem in that there is still going to be issues about some people being able to access it. You know, those at the margins of having a concession card, for example. If they're up for, $15 for a family of 5, it's going to be a lot of money. So there is still going to be some issues with access. I think overall the biggest issue is just the fact that we don't have enough, and unfortunately due to the failure in strategy on this, we just don't have enough in play at the moment. So although the notion is that we're only going to use it for very strict circumstances at the moment, which is we should try and diagnose them, really overseas they're much more widely used. And even though there is actually a worldwide lack of them, most countries have far more in play right at this moment. And so individuals can actually start to make individual decisions about if they do a test, whether they can go safely into a nursing home or see their vulnerable relative or go into a crowd. And that would be a very helpful thing to try and slow this whole thing down from a community level. So we don't have these at the moment, and that's the biggest problem. And really it is a great frustration in the current management of the whole COVID pandemic.
Well, there aren't enough RAT tests at the moment, and now the case is if you return a positive rapid antigen test, you no longer have to get a PCR test. How can we track infections now?
Well, I mean, that does have some logic as a decision in terms of the fact that a positive test they have very low what we call false. They have very low false positive test. That means positive test tends to be really positive, so it's unlikely that they're going to be negative. So once you've had it, there doesn't appear to be a huge point to go having a PCR test. The issue then is how this is linked into the system, and that's for two things. Number one, numbers. I think it is still useful to have some idea of numbers so we know where we are in the whole pandemic and where we are on the curve, and we can make decisions from an overall perspective. But I think the other thing is how an individual is able to then interlink into care in terms of either support for medical services, support if they're high risk, support if they can't, for mental health services, support for being able to get priority for shopping and things like that. Those are all things which are really still very critical and unfortunately haven't been set up at this time, and we're not ready to go with that. These things urgently need to be set up so that we can get a positive test leads to the right care for the right person, particularly if they are at higher risk.
Scott Morrison said yesterday the advice is to call your GP in that instance. Is that the right advice?
Well, it would be if we'd had enough support. Unfortunately, the COVID care package, which there was this package of care which was announced a while ago, isn't enough. And we've had meetings about this, and it just is nowhere near enough. There is a fair bit of a gap. There is good things that have happened. There's a thing called Health Direct, which has been set up to try and inform patients about the symptoms they should be looking out for and when to call their doctor or when to call an ambulance. And I think I would direct a lot of patients to go look at that Health Direct, and it's got a symptom checker, go to that. That's a really positive thing. But unfortunately, that's not linked into state systems, and it isn't fully linked into general practice across the country at this moment in time. And unfortunately, on the ground, the problem is that this is a huge change for care. A lot of the care is being done through the states. Now it's going straight to general practice. And to some degree, there isn't the sort of support we need. We need things. I'll give you an idea of the things we need. We really need a very increased telephone access. At the moment, the telehealth items for telephone are limited to shorter consultations. I mean, these patients need longer time. We need support for coordination, nurse coordination of these patients. We need the PPE and the right sort of PPE, not just the normal mask. We need the proper PPE. We need oximeters. We need RAT tests so that we can actually start to screen the right patients if we have to provide care. And most important, what we need is this line of clinical responsibility for patients to be clear. When does the state look after them? When do we look after them? Because at the moment there's a gap because of this, and partly it's because of the number of cases, but partly because it hasn't all been set up properly. What we don't want is patients falling through the gaps in terms of clinical responsibility, because that's when bad things happen to the patient who's isolated and actually then unfortunately doesn't get the right care that they need, and then bad things happen to them.
Yeah, I understand. Just finally, there are calls for school holidays to be extended by another 2 weeks. There's concerns about the vaccine timeline with the children rollout to begin from Monday, but at the same time, of course, the booster rollout. Would you support this, and is general practice ready to do this rollout for 2 different cohorts?
Yeah, it's a really tough question because schools are so important in the fabric of society. I mean, and the thing is that they're the last things you want to close down. However, given the numbers in terms of Omicron, and because of the fact that we're only just starting the vaccination while we're concurrently starting the boost outbreak, meaning that we're probably talking about the largest number of vaccines we're having to get into arms at any one time in the whole pandemic. Look, this is something that is a serious consideration, and I think the states are looking at this. I haven't really worked out. This is a very, very, very tough question because of the competing issues of schools being so important for our kids, but also the state we are in at the moment in terms of the Omicron outbreak.
Tough decisions ahead. Dr. Chris Moy, thank you so much for joining us.
It's a pleasure.